We can start with the session. Good evening, guys. Thank you for joining this webinar on physiotherapy perspective on sports psychology. And I'm very happy to announce the speaker for today. Let me introduce now Dr. Bindya Sharma. She has done her MPT, Musculoskeletal and Sports, and she's working as assistant professor in DY Patil University, School of Physiotherapy, Navi Mumbai. She has overall of 12 years of experience, which are largely in academics, about 3 years of experience as senior physiotherapist in London, UK. So I'll be muting my mic and I'll be unmuting ma'am's mic. And ma'am, you can continue with your presentation. Can you hear me? Vinay ma'am, you can unmute your mic.
Okay. So, thank you, Piyush, for the introduction. Am I audible to everyone?
Yes, ma'am.
Okay. So, the topic that I have selected today is physiotherapy perspectives on sports psychology. The reason why I have selected this topic is because during my stay in London, when I was working there, I had the opportunity to do a short course on sports psychology. And I used to wonder that I am not a psychologist. How would I be able to help my patients? But then physiotherapy and psychology is not really very different. We are incorporating psychological skills in our daily life treatment as well. So I thought, why not club the two concepts? Why not club physiotherapy for sports psychology? Uh, the actual sports psychologists generally they have a training wherein there are two routes of entry. One entry is through the psychology route. They study their psychology subject as a major subject, and then they enter into sports specialization. Or otherwise, they come from the human kinetic system studies and biomechanics and exercise science route or physiotherapy, and then they do a specialization in sports psychology. So here I am with my presentation. Why sports psychology for a physio? This is the first question that I think will come to all of your minds. So after this presentation, after this presentation, you will be able to answer these questions. So whether it is in the scope of your practice, that is one question. The other one is, are you really aware of your role as a physio when it comes to dealing with biopsychosocial component of a sports injury? So this terminology of biopsychosocial, you must have heard it n number of times because we are evolving as physiotherapists and we've got new models and concepts of treatments incorporated into our system. So these are a few questions. And the last question is, are you practicing any interventions to deal with the psychological aspects of sports injuries? So after this presentation, I think you will be able to answer these questions for yourself. So why psychology and physiotherapy? Because mental health has always been part of physiotherapy. So if you remember in 2018, the theme for World Physiotherapy Day was movement for health. Of course, this is more for the mental health of a normal person as well as patients. But yes, mental health has always been there in physiotherapy. When we studied our physiotherapy course, the first answer that we write in our long-term, short-term goals is patient education, psychological counseling. So these concepts were always there as part of physiotherapy. And why the second important point is why we need to know sports psychology because sports is 10%, only 10% of a physical activity, but 90% of it is mental. So when the athletes are so much engrossed mentally into their sport, of course, when they come to us for rehabilitation, we will have to take the mental route or we will have to take the psychological route to treat them. Okay, so these are my relevant points for choosing sports psychology for today's topic. Okay, so now what does a sports psychologist do and what does a physiotherapist do? So again, this is my model and my concept. Okay, so brain is the center part of it. This human mind So the psychological aspect of any injury, okay, if a sports psychologist has to look at it, he would look at it from the source or from the root, that what is causing, whether there is any motivation issue, or whether there is any there could be any other sort of psychoanalytic behavior, any sort of a thing could be the source or cause of a particular problem. And because of that problem, when that problem is perceived in the mind, it gives rise to physiological reactions, and those physiological reactions would be increase in the heart rate, increase in the respiratory rate, or increase in the motor, in the contractions of the muscles of the body, we get tensed. So I think, from my point of view, physiotherapist fits into the physiological reaction part, and the sports psychologist would fit in both the components, but they would more analyze the source of a particular psychological issue, a psychological problem, and try to sort it. But we as physios would be just dealing with the physiological component or the motor component of a particular psychological problem. So this is my perspective when I look at it. That why sports psychology and how can we incorporate the two together. So everything is research based nowadays. So we need to see certain research points also, because why I keep stressing this is because, like as physiotherapists, and we are fighting for a council, or we want an independent stance, and we don't want any other profession to, we don't accept anyone else having a smaller degree. So, even the sports psychologist would probably have a problem that if I say I have done a short course in sports psychology and now I'm a psychologist. Okay, so the roles has to be defined clearly, that who is going to do what and who is going to do what. So when I see a sports psychologist, I think their primary role is, they enhance performance. They do mental. They try to develop mental skills in the athletes so that their performance is enhanced. That is their primary role. Or if the if the athlete complains of a choking incident while playing, or mentally choking incident, or that I have less motivation, or I have concentration issues. So there again, the sports psychologist can step in. Okay, injury rehabilitation and psychological issues around injury rehabilitation, I think, is what we as physiotherapists can deal with. Okay. Now to support my points, I have these research works here. So we know that we always follow WHO guidelines. We have the ICF, which recognizes pain as a subjective experience, and they suggest that the healthcare professionals should shift from treating in a biomedical perspective to a biopsychosocial perspective. So we have the psychological component incorporated. We have the social component incorporated into our system already. Although the biopsychosocial model is considered a better model for explaining disease and disability by some, what is the current scenario is the physiotherapists, they report uncertainty about identifying or assessing the psychological aspects within their practice. So like me, when I started studying this particular aspect, or like any other physio, I think we know certain concepts but we don't know how to apply it. So most physiotherapists recognize the importance of implementing psychological strategies during athlete rehabilitation, but they are unsure whether, the first point is whether they are unsure whether it is within their scope of practice. So yes, it is within the scope of our practice, but only when we are dealing with an injury rehabilitation, and you can see that the patient is not recovering, or there are certain psychological factors that is pulling back our patient. We are not the ideal or first point of contact if the patient wants to have, if the athlete is not having an injury and he just wants to enhance his performance. So we cannot I think we are not the best person to do that, but yes, we can definitely speed up their injury rehabilitation process if we keep the psychological factors in mind. Okay, so common psychological strategies implemented, generally they are whatever we know we've heard of is goal setting, encouraging positive self thoughts. But the barriers to implementing these strategies include lack of knowledge, one, training at undergraduate level. There's no training at undergraduate level, lack of postgraduate psychology courses, and the perceived stigma that athletes also, they don't seek psychological support easily. Another body of another section of research suggests that why physiotherapists are important part of sports psychology when it relates to injury is because we are the first point of contact for the patients. After the patient has had an injury and if the physiotherapist is on field, the therapist goes, runs, and takes care of the patient. And if he's been dealing with the team from before itself, he has a lot of rapport with the team. The athlete who's facing any psychological issue, I think the physiotherapist or maybe the coach, we two people will be the first to identify that something is amiss, or if they have to reach out to somebody, I think physiotherapists are the first point of contact. Why the research suggests why that is so is because our treatment is so physical that we use the sense of touch with our treatment, and it is a general tendency of the patients to report their psychological issues when they trust you, and the component of touch is involved. So one body of research suggests that this is the reason why physiotherapists can do this kind of an activity. So now like I said, the biopsychosocial model. There have been refinements in these also. Now these are the models, the biopsychosocial model. It's a little complicated, but there are many factors that defines the injury rehabilitation of an athlete. The center of it is the psychological factors. Okay, personality, effect, behavior, and other factors they together contribute to the sports injury rehabilitation. So, biopsychosocial intermediate outcomes that we seek are range of motion, strength, endurance, joint laxity, velocity, pain. So, when we see all of this, if the psychological component is impeding it, we will not be able to achieve our goals. So that's your biopsychosocial model. Then there came the cognitive model as well. They said that whatever is the situation a person is facing, say for example, I mean, I'm under a stressful situation right now, and my mind is making some cognitive appraisals to it, and then accordingly I am deciding about my coping behavior and coping mechanisms. So that is how we can incorporate this particular component, that cognitive appraisals is generally hampered or generally affected when an athlete is under stress. Okay, so that is the component that we are going to deal with when we are dealing with our patients. So this cognitive appraisal is responsible for their coping, their beliefs, and their attributions, and also it leads to their, it's directly related to their recovery outcomes. So these are the two models, and there's a third model which tells us the stages of psychological stages that the athlete goes through after a psychological injury, after sports injury. So those psychological stages are denial, anger, and non-acceptance. Then eventually they accept, and then lastly is the coping mechanism. They stop giving resistance. So these are the 5 models that I think this model is being followed by the sports psychologist as well. But we need to follow it more because we are the first point of contact when there's an injury. Okay, so the research work, again coming back to the research work, there were many studies conducted. This particular study was conducted in UK, and the second one is conducted in the within the Irish physiotherapist community. They wanted to know whether physical therapists are comfortable dealing with psychological factors, whether they are comfortable, what kind of treatment techniques that they are implementing. So this is a graph which shows that yes, they encounter psychological conditions while treating injury rehabilitation, physiotherapists do encounter, and they list stress and anxiety as the first problem that they are able to identify within the patient within their rehabilitation process, and depression and problems with pain management. These are the first 3 points that they are able to recognize when they are dealing with their patients. And the second study also had similar findings. Stress and anxiety was the first component that they say they are easily able to identify that this particular patient has stress, anxiety, and to be very specific, anxiety of re-injury is present when they are dealing with athletes undergoing rehabilitation for an injury. Okay. So what are the psychological interventions that the physical therapists follow? They try to do, they create variety in rehabilitation exercises. They try to avoid monotony. They try to create variety of exercises. They use short-term goals. Okay. They encourage positive self-thoughts. So these are the first three things that most of the physiotherapists follow. Uh, then another question in this was whether what are the psychological interventions that therapists would want to train further in. So they wanted to understand about individual motivation, effective communication, and enhancing self-confidence. Here, the fourth is stress and engagement. So use biofeedback only for a positive purpose. Otherwise, it will lose its uh, importance. Okay? So providing athletes with information regarding their improvements makes them more self-confident. Again reduces their anxiety and negative thoughts. Now, I think this is the last point about social support, about intervention, social support. So again, social support, we all talk about, this person is amongst friends or this person is amongst family, and he has a lot of social support. It doesn't work. A person can be alone even when he has friends. A person can be alone even within a family or within a party. So what are the components of your social support? Okay, there is emotional support, which usually comes from the family, and here in this particular situation it will come from the physiotherapist, but the athletes really appreciate if it comes from their coach. Okay, so that emotional support should be there. And there is something called as instrumental support. Okay, now instrumental support is nothing but tangential aid, or something like if your association, or if the place where you're playing with, uh, for if they say that okay, you take your time for recovery, we will take care of the cost, we will take care of your leaves, or you do not worry, nothing will happen, kind of a thing. So that sort of instrumental support is needed from your organization, from your work atmosphere, whatever, wherever you are working. Then there is appraisal support. Now, what do you mean by appraisal support? This is very important. Here, if within a team, you are a therapist of a team and you have other members as well, other members of the team who have been injured, okay, with you, before you, after you, but if they talk about their experience or their journey of recovery or their journey of rehabilitation, it really gives a sense of support to the therapist, to the athlete. Okay, so it has an immense impact on the uh, athlete, more than the emotional support. Okay, and there is informational support. This we've already spoken before about this. Informational support in terms of your injury process, your rehabilitation process, your anatomy of the injury, the physiology of the injury, the pathophysiology of the injury, everything about that. If the athlete is aware, it helps them in recovery and it helps them in their self-confidence. Okay. Now, as therapist, like I said, I will have certain roles to play, which I have already elaborated. But I should also know that when to refer an athlete to a sports psychologist. When can when the situation is not in your control. Certain aspects, yes, we can deal with. Certain, we should know when to refer the patient to when the athlete to a sports psychologist. So these are a few red flags. Okay? Feelings of anger is always there during the rehab process. Obsession with the question of when one can return to play. Denial, injury is a no big deal. Okay, exaggerated bragging about their accomplishments. We have seen such kind of patients in our setup many a times. Okay, guilt about letting down the team, withdrawal from significant others, and rapid mood swings. But the real two red flags, which I think we will not be able to handle effectively, is withdrawal. If the athlete withdraws within himself or does not interact with anyone, socially is completely disconnected with with his loved ones, and yes, it's a red flag. He needs the help of a sports psychologist. And self-defeating thoughts. So repeatedly, if that self-defeating thought comes, like they keep saying when you get an injury and you have to sit on the bench and watch games, that kills you inside. Okay, my body could stand the crutches, but my mind couldn't stand the sideline. So when they speak something like this, it shows that this is beyond our control now. We need to refer. Okay? Now with all that we have done, I'm towards the end of my lecture. So just one or two case studies. Now Mr. X, he was an ice hockey professional. Okay. He already had difficult history of injury behind him, many injuries. But despite two surgeries at the Achilles tendon, he had no capability to push off his foot. Additionally, the scar had not healed up to a significant extent. So probably he was re-injuring himself after the surgery. Psychologically, there was disturbances of self-confidence as well as an unrealistic body image. Moreover, unfavorable time in the season and moment of his career were also delicate factors in the rehabilitation. Okay? These points are important. Okay, how is the athlete taking his coming out of the game, or the season? It's now training season. It is now play season. So I will not be able to go back. How is the athlete talking about it? Is the athlete really hyper about it, or has completely gone into a shell about it? So we need to know these factors. With the psychological interventions that we can consider is extensive interview at the beginning. Okay, so why that is important is, if you remember in the positive self-talk, the first step was listening. Okay, so you have to do an extensive interview at the beginning and listen to the athlete, and then you come to a detailed goal setting and rehabilitation plan process. You have these two things will go together. You will tell them that this is my rehabilitation plan, this is your short term goal. And I am not going to disclose my long term goal right now. I'm going to divide my short term goals even shorter into smaller parts and present it to the athlete. Okay? Then I'm going to do relaxation exercises with this person, and then I'm going to do imagery, which consists of healing. He has to imagine that his scar is getting healed and his movement at the ankle is coming back. Okay. Then eventually I will do visualization of the technical moves. Okay. We can do this. Imagery is in our syllabus. We do study, we are now even studying graded motor imagery for neuropathic pain. It is very much there in our syllabus, so we can follow. But still, if any physiotherapist feels incapable of doing it, there are always courses available, webinars available, and they can update their knowledge, and it is practicable. We will not be doing any harm when we do this, unless we need to remember the rule of imagery for rehabilitation patients. That is, we have to teach them relaxation incorporated into the imagery, seeing the effect of the relaxation on the patient, and only then move towards kinesthetic or technical moves imagery. Okay. In case study 2, Mr. X is a footballer with an ACL tear and is through his fourth month of rehabilitation. The treating therapist finds that the patient is getting better in terms of strength, but the patient demonstrates fear of movement by repeatedly saying that he thinks his career is over. Okay, The lengthy time of the recovery has contributed, no doubt, to a significant loss in muscle strength, but also decline in the mental well-being, as he feels dependent for his daily activities. He reports fear of moving his injured knees. So the treatment that I will follow here is I would give him feedback. I would be doing my strengthening protocols and all my regular physiotherapy treatment interventions, but I will be giving the person feedback. The athlete should be given a feedback about his movement. I would be using different tools like maybe since I didn't have an EMG, I would use a BP app machine and show him that when you press, how much is the manometer going up, or something like just showing them the strength of the contraction that they are producing. Okay. Then the range of movement, I can always tell that today it is 5 degrees more. So something like this, a feedback. Then I will teach him relaxation exercise, and then I'm going to go to kinesthetic imaging. Okay. That is all from my side. Now I am open for question and answers. Uh, Piyush,
Yes, ma'am.
any, yeah, is there any
Yeah, ma'am, there
question?
was a question at the very starting. It's from Dr. Vidhi Dave. As a final year student, there are various departments for choosing masters in it. Then, how you chose sports psychology for masters and research work?
So I didn't get the name. I think Riddhi you said, right? Riddhi,
No, Vidhi.
Vidhi. Okay, so Vidhi, I haven't done my master's in sports psychology. When I was in London, there were many courses available. Okay, it's through a university. Now, like I said in the beginning of my lecture, there are two routes to get into sports psychology. One is the human kinetic way, or the biomechanical or exercise science way, wherein you have these semesters wherein you study sports psychology. Okay. And then there is the pure psychological route that you study, you do your psychology course, you do your MA in psychology, and then you specialize in sports psychology. I think in India, uh, Guru Nanak Dev University started with sports psychology for physiotherapists as a PG specialization, but I am not sure if they continued with it. You may check with them.
Okay, ma'am,
Yeah.
and there are no further questions.
Okay.
Just a second. Yeah, there are no further questions. Thank you very much, ma'am, for your wonderful presentation. And actually at the middle of the session, my Zoom crashed,
Okay.
so I lost everything.
Oh,
The recording. So rest there are no questions, and everybody was like praising within the presentation only. There was one Dr. Rizwan who said around 3 times she has wrote that good great session, ma'am.
okay.
So thank you very much, ma'am, for your precious time.
Thank you so much. Thank you, everyone. And if ever there's any question, you can reach out to me anytime, because sports psychology is a new field when we are trying to incorporate it into physiotherapy. I would just like to add something. Piyush, can I say?
Sure, ma'am.
Yeah. So, generally, sports, not sports psychologists, any psychologists, they choose, there are, like every profession, there are one set of researchers or academicians and another set of practitioners. Okay. So, I have right now ventured into academics of it and research work. So, I have already done two projects with my students in DY Party. And yeah, it's a very interesting way of finding out, what are the psychological factors which will improve. So if somebody needs any research help or anything project related, I'm always available. So you all can reach out to me. I work in DY Patil, and Piyush can share my details if needed. Okay? Thank you so much. Thank you
Yeah.
for the opportunity, Piyush.
Thank you, ma'am. It's my pleasure to have you here because I think only one time we had a discussion like this in Bangalore. You told me about sports
Yes.
psychology, and I'm working in a sports. I know the benefit of using the psychological part in sports. So thank you very much, ma'am, for enlightening us this kind
Thank,
of.
thank you.
Thank you, guys. We are logging off. Thank you for joining this webinar, and I think everybody enjoyed the webinar. Thank you, ma'am. Thank you, guys, and we are logging off. Thank you.